Okay, my name is Hilda, and I'm at the Share Center as the two previous presenters. This presentation will focus on capacities that will support, develop, and enhance resilient performance in different healthcare settings. Resilience in healthcare is the ability to adapt to challenges and changes at different system levels to provide quality of care. And this means that quality and safety is not just about the absence of negatives, it's also about the presence of some capacities. And we have therefore conducted a study to identify capacities for resilience in healthcare based on data from many different healthcare settings. And in the following now we'll present for you the different capacities so you can get an understanding of where attention is needed in order to ensure and evaluate resilient performance in organizations. And the resilience capacities have much in common with the resilient potentials by Hollnagel and builds on this work. The first capacity needed for resilient performance is structure. And structure for resilience refers to structures that support work and practices within the organization. Sub-themes here included having accessible, appropriate, and compatible technology, to have clarified roles and responsibilities, having available arenas for face-to-face communication and learning like reflexive spaces, and furthermore to have formalized plans and procedures for emergency situations and interventions. This means that even though definitions of resilience underscores adaptations to handle challenges and changes, adaptive capacity still needs to be balanced with supporting structures and standardizations. The second capacity is learning. And learning describes how the organization facilitates and provides learning activities and learning opportunities. Learning was found to include the following sub-themes: collaborative learning, where learning was achieved through both formal and informal interactions between different healthcare professionals, with stakeholders, across organizations and across levels. Learning also relied on the import of external knowledge, and training was found important and included activities like simulation, where procedures were practiced on. As also described in the learning potential, learning is key for resilience, and without learning of how and why things go well, it will just easily end up as a pat on the back, something the organization will not improve on. Furthermore, learning of why and how things go well is key for transferring knowledge and practices to other areas. Alignment as a capacity for resilience refers to various adaptations introduced for aligning demands with the situational circumstances. Adaptations included adjustments and transformations of care practices to align with the specific patient needs. Alignment efforts included trade-offs and advocacy to establish shared goals and understanding between the involved actors. And healthcare professionals' ability to self-organize was found important to ensure quality and care for patients. It is important to ensure that adaptations are not just firefighting behavior, as the bird who is nesting in a traffic light in the picture here, but that it also include long-term solutions. If not, you will have to perform the same adaptations over and over again because no changes has been made in the organization. Coordination is the next capacity needed for resilient performance, and coordination refers to the organization, how the organization facilitates and organizes their work. And 4 sub-themes made up this capacity. Care coordination refers to how different actors coordinate care around the patient. Furthermore, having available buffer resources was found to be enabling for resilience. And the continuity of staff and resources were also highlighted as highly valuable. In terms of collaboration, both inter-organizational and interdisciplinary organization was found enabling for resilience, and something that healthcare professionals wanted to have more of in their work. This is a picture of my son's school trip, where they for the first time tried rafting. I think this picture is a good illustration of the importance of leadership. The boys were totally depending on their rafting leader to guide them through challenging situations. And as the picture shows, the team is operating on the front line, trying to handle the contextual setting, while the role of the leader is to guide them through and provide motivation. Leadership as a capacity for resilience also concerns how leaders facilitate, support, and motivate and contribute to the organization. Leadership included 4 sub-themes: empowerment of staff, the development of an inclusive work environment, interaction of leaders to support and motivate the staff, and being able to prioritize between conflicting demands. And here is a picture of my 2 other kids, where the youngest one unfortunately always have suffered from a low level of risk understanding. Anyway, for resilience, risk understanding refers to how the organization perceives and reflects over risk that may affect the patient, possible adverse events, and to the understanding of consequences of actions and adaptations. And it involved proactive responses, reactive responses, and risk perception. Involvement is found important for resilience and refers to how the organization introduces and involves different actors, and whether the organization systematically gathers information from different actors. Main actors were found to be next of kin, patients, and other stakeholders, like for interest groups for cancer patients. Competence as a capacity for resilience refers to having the appropriate knowledge, attitude, skills, and experience for performing sound decisions, knowing when to take on necessary adaptation and understand the consequences, and to have the situational understanding needed to provide quality care. Facilitators for resilience concerned how the organization or different employees facilitate for positive impact for the organization. One type of facilitators was knowledge brokers, who facilitated knowledge translation across boundaries and was thereby facilitating for a shared understanding between different actors. Another type of facilitators were champions, who facilitated through their actions, like taking on extra work and responsibilities to ensure care. Identifying and supporting these facilitators within the organization was therefore found highly important. Communication for resilience is the final capacity and includes the capacity to translate information to the specific receiver, aligning the message to the actual situation, be open for feedback, and furthermore to be able to communicate across different disciplines, levels, and organizations. As a tool for translation, boundary objects were found valuable for shared understanding. And boundary objects refers to shared points of reference and can be like illustration or frameworks which are understandable for all participants. And furthermore, face-to-face communication was found to support the transfer of tacit knowledge, like work and practice. The takeaway from this presentation is firstly that these 10 different capacities supports resilient performance in healthcare. And secondly, it's important to understand that all of these capacities together facilitates resilience. It's therefore not enough to do really well in a specific capacity, like for instance competence. Competence is not enough on its own. It needs to be appreciated or supported by, for instance, leaders, and have available arenas to nurture and learn where they can learn. This framework therefore needs to be viewed in a holistic way. And finally, these capacities relates to the organization and not on an individual, meaning that resilient performance is not achieved by having a single person with all these capacities. Resilience in healthcare is related to the organizational performance. So this was a really quick introduction to the resilient capacities. Thank you so much for the attention.